Hi, I'm Kelly Puente with the Long Beach Post, and I'm here today with my colleague Sebastian Echeverry and Councilman Rex Richardson of the 9th District. And we're here to talk today about some health disparities in Long Beach as COVID and some of the issues that COVID has brought out in the city, and also taking a closer look at Long Beach's recently proposed framework for reconciliation plan and how that would look in our city, and talk about some of the deeper issues with that. And so Rex, thank you for joining us today.
Thanks for the invitation, Kelly, Sebastian.
And first off, I mean, I can't even imagine what it's like trying to be a civic leader and be on the city council, trying to help lead the city at this time. Can you talk a little bit about just what it's been like with COVID, and then the unrest and the racial injustice issues, economic, everything? It's like it's like a tsunami.
I think you nailed it. I think, if you think about it, Long Beach is facing a crisis on three fronts: a pandemic, a once-in-a-century pandemic. We're facing the economic challenges and fiscal challenges that all cities are dealing with as a result of the pandemic. That is exacerbating issues that have already been in place, like sort of housing injustice and all of these other things, and homelessness and our housing crisis. And we're also facing what me and my team call the equity mandate, which is cities around the country have communities, residents have stood up and said, hey, it's time that we address the issue of institutional racism, police brutality, and systems that are not designed to ensure that people can fully participate. So we call that the equity mandate. These have come front and center to Long Beach. All three of these issues have come front and center to Long Beach at a time when we were just a year ago reaching our lowest levels of unemployment in the city's history. To today, we're dealing with unemployment levels that rival the Great Depression. So
we're like at 30% right now, I think.
Yeah, absolutely.
That's huge.
Absolutely. And what you see is that, although we're making all this tremendous progress, this moment has really exposed where we really need to build up to have a more resilient city. So I've been thinking about this as what have we learned in the last few months about resiliency for a city? It's no longer just about being prepared for the earthquake or the tidal wave or climate change. Resiliency now means you need to have public health capacity. Our health department stepped up when we declared the emergency, and the regions looked at how Long Beach has responded to testing and all of these things. Long Beach has stepped up and put forward the most significant economic relief package across the region when the economic crisis hit our hotels, hit our restaurants, and we've been sort of continuing to drive that issue home. And 2 months ago, when we had unrest in our streets as a direct result of the murder of George Floyd in Minneapolis, and I used to live in St. Paul, for the 4th grade. Minneapolis is a diverse city. When I was at the White House a few years ago, I sat on a panel with the mayor of Minneapolis who was talking about racial equity and my brother's keeper. And for an issue like the tragic George Floyd incident to take place there, a city that's smaller than Long Beach, that's made commitments earlier than we have to racial equity, it calls all of us into question to say every American city should check under the hood, do a real analysis on what needs to happen to reconcile with what the systems say versus what the experience in the public says. And so we met that moment at the very next council meeting by passing a resolution to declare racial injustice and systemic racism a public health crisis, but also dedicated resources and staff to begin a reconciliation process that heard thousands and thousands of hours of public testing, not thousands hours, that heard from thousands of participants, over 15 sessions and 4 community town halls that equal in 30 different hours of public testimony. And so that set the groundwork for this set of recommendations that have come out. That's coupled with about $3.2 million in the budget to help make those recommendations reality. So at every point in this crisis, from the health to the economic to the equity issues, Long Beach is rising to the occasion and meeting this moment. And we've learned a lot, and there's still a lot more to do.
And the city's really never done anything like this before, as far as this comprehensive a plan to address racial inequality, which we know in Long Beach, we're a very diverse city, and we have a history of inequality in the city.
Yeah, we've dipped our toe in the water on a number of different things. You hear about the violence prevention plan work. You hear about, so when I got on council, I championed the establishment of the Office of Equity Originally, it was proposed as the Office of Racial Equity, right? It was sort of pared down to the Office of Equity, because at that point, people weren't necessarily as comfortable with addressing the issue of race directly. So we built certain capacities, governalized racial equity, a 2-year process to develop our economic inclusion strategy. But all of these plans, our youth strategic plan, all of these things have an equity lens in it, but they haven't been implemented due to the city council hasn't said it's a top priority. The way that the city council has said, hey, let's get serious about it. It's a top priority. These recommendations, a lot of this has been in place for many years, and it just hasn't had the focus and the resources to get them done. It's a lot of great recommendations here that are feasible.
And one of the big and major inequities we've seen, obviously, is health, in which we've done, right. Sebastian and I. And I know, Sebastian, you wanted to ask a little bit about North Long Beach and just the huge health disparities brought out by COVID specifically.
Right. So doing research for the story, I believe Kelly, you and I worked on a story about how COVID-19 has actually highlighted some of these longstanding issues in our health here in communities in Long Beach. And so we took a step back and we wanted to look at, okay, what were those issues before the pandemic hit? And when we looked at the 2019 community health assessment, it really highlighted some of those issues. And Rex, you and I spoke about that as well for that story, if not that story, the one about how COVID-19 has accelerated a lot of these issues or highlighted them. So I just kind of wanted you to kind of talk about what are some of the challenges that you're seeing when it comes to health disparity, and what's being done to address that?
Well, it's a great question, very relevant for this time. I want to sort of take a step back and think about root causes. When you see disparities, they're not by accident. These are products of systems that have been in place for 100 years, if not more. And these systems, they're designed to they're laced with the values at the time that those systems were instituted. And if those values don't prioritize public health, the environment, when you live in areas next to freeways, open space access, then what you see are health determinants that are results of that really guide our ability to live. For example, if you think about the 90805 community that I represent in North Long Beach, I represent a portion of it. A portion of it's also 908, the 8th district, and a small portion is the 7th district. And so this zip code is 100,000 people. A fifth of the city's population lives there. A fifth of the city's students go to school there. But you also know that in my district, we have 1.2 acres of open space per 10,000 residents. Some districts within the city have 10 times that amount, 10 acres of open space per 10,000 residents. When you think about the fact that we're bisected by not 1 but 2 freeways, the 710 and the 91 freeway both intersect within the North Long Beach 9th district community. But then when you look at how the city has addressed from a long range planning standpoint, we really haven't addressed, there's a lot of sort of smaller plans that don't intersect and create real outcomes for the North Long Beach community. And that's why you see things like outdated land use, more motels and liquor stores than grocery stores, more fast food than sit down restaurants, more, you see more of these things, more public infrastructure and freeways than open space. That means that we haven't placed a really local specific lens on planning. And so in order to address that our long-term health, we partnered with Skag to begin a process called UPPLAN, this Uptown Planning Land Use and Neighborhood Strategy. It looks at long-term plans, updating corridors, land use, zoning, all of these things to create a healthier community. We've also acknowledged that there's been a lack of investment in the North Long Beach community. You haven't seen, even through redevelopment, all the other things, you haven't seen commitments to public institutions. And why would we expect the private sector to invest in our community when we haven't ourselves? And so we've taken the lead in investing in those things. The Michelle Obama Library is a great example, largest, most modern community center library in the city, aside from our main branch, is an anchor right there on Atlantic Avenue. The Jordan High School modernizations, Houghton Park and the health facility at Houghton Park, those investments help us bring workforce, health equity, teen center opportunities, and all these things to the community in an area, again, with a lot of focus, a lot of need, but then again, not a lot of resources. The response to that has been tremendous. The public's engaged. We have a Coalition for Health in North Long Beach, didn't exist before. I helped start that organization. We've got more nonprofits locating there that weren't there before. Long Beach Opera, Long Beach CAP, they weren't there before. They're here now. We have some anchor institutions like Pools of Hope, Andy Street, that have really been fighting the good fight for a long time. Groups, our business district, Accelerate Uptown, the Long Beach Center for Economic Inclusion, a lot of activity that's there now that wasn't there before. So altogether, the vehicles are in place for us to really drive policy and resources toward health-based outcomes. And I think that's some of the infrastructure that's been put in place in North. We need to make sure that infrastructure is starting to be put in place in other communities as well, so that we all can sort of more comprehensively think about health equity as a city.
Right. And I think one of the things that go hand in hand with health equity is it's economic equity as well. Because based on the community health assessment, a lot of it was just if you make more income, if you can support the family, you don't really have to worry about a lot of health issues, or you grow up in an environment that you have that support system. So what steps are being taken to address the economic side of that as well?
Mm-hmm. I think it's great that you highlighted that all these issues are intersectional. A lot of times you hear the public say, well, if you just had this, then everything will be fine. Or if you just did this, and everything will be fine. And that ignores, that places the blame on, say, individuals, and say, if there's a problem with, say, Blacks or Black youth or Latino youth, then the issue is that individual. What we should be saying is the issue is the system. And these are outcomes the system is provided. And in order to address it, you have to address the system's change. And so we've taken certain steps. I can point to our Everyone in Economic Equity, Economic Inclusion strategy. It included listening sessions at one Capitol Epic Award, really comprehensive listening sessions touching all parts of our community. It had we commissioned with USC as well as PolicyLink to do an economic profile, an economic equity profile, growth profile of Long Beach that really pointed out, and helped define those disparities. The Latino community's done an incredible job with the Latino economic profile. A lot of great data in partnership with Cal State Long Beach there. So all of that helps set the basis. The Everyone In plan put forward strategies like looking at inclusive procurement, looking at anchoring workforce development into the communities. Strategies like establishing a community development center to Community Development Corporation to really focus on sort of deploying these things out to the community and building deeper community partnerships. And you've seen a lot of that begin to transpire since the COVID-19 pandemic. So there's a lot of really quality strategies, housing, soft second mortgage down payment assistance programs to make sure that renters and people of color who have been excluded from the market have a path to home ownership. All of these strategies, actually what they mean is a more resilient city. It means that we won't have these patterns of disparity that really are not good for our long-term fiscal health and resiliency as a city. So those are the types of things that these strategies hope to address.
And some of those are included in the reconciliation plan.
Absolutely.
And as far as the reconciliation plan, which just came out this week, yep, and for the city council, is it next Tuesday or 2 weeks?
Yeah, the 11th.
11th.
Yeah.
It includes 107 points of action. Mm-hmm. And when we posted the story, we did get some comments from people a little skeptical,
right,
that they don't expect to see any real change. Mm-hmm. What are some key action plans where we're going to see some immediate change? Can you talk about
sure,
what we could see right away that will notice some change going on?
Sure. I think when you look at the total package of what the budget, so the framework calls out 107 strategies, but that's, say, your roadmap. What is the vehicle to get there? Well, they've reorganized things like the Office of Equity under the city manager and added capacity in this budget to begin executing many of those things. Added capacity as it relates to health equity, a commitment to a health equity center, which is really exciting. A commitment in there to building more capacity for youth and exploring a youth development office, which has been a demand of the community for a long time, which is a big deal. Groups like Come On Girls in Action and others have demanded this. And there's both structural and one-time dollars within the budget to begin working on this immediately. There's also, the city council knows that there needs to be more structural funding to do these things. And so we've moved forward. We did some initial research, and we've moved forward to placing oil production tax on the ballot to really focus on youth and early childhood education, climate resiliency. There's huge job opportunities in climate resiliency, and addressing public health in the midst of our pandemic, which each of those had significant support from the public, 68-70% of support on those issues. And so those are the issues that people want to see. Well, those are in direct alignment with the reconciliation strategy. The reconciliation strategy highlights a number of plans, from our economic inclusion plan, our community health assessment, and our climate action and adaptation plan. So it's really intersectional. What the public should know is that there's funding and strategy in place to put together a team to address a lot of facets across, a number of different sections. And one of the biggest things that came out also is, how do you hold police accountable? There's a lot of faith that's been lost in the CPCC process. Both the reconciliation document and the budget calls for us to begin the process of shaping the ballot measure to repeal and replace the CPCC with a more modern current oversight. So we can start with that immediately.
Has had issues over the years just with accountability and commissioners not really even seeing all the police complaints. What would changes specifically do you think the CPCC needs?
So I think the most important thing is public confidence and accountability and transparency. And so I think, we just came out of creating a new ethics commission, a new redistricting commission. All of those, we looked at common cause and best practices. I think we need to do the same thing here. My opinion is that the ballot measure should repeal the CPCC and replace it with a modern oversight body that has independence and that has the ability to issue subpoenas and conduct investigations, and that there is some transparency and accountability in how those are processed. And I think those are most of the concerns that people see, is that the commission may make a recommendation, but has no power to actually see what happens or from those recommendations. And so from a public confidence standpoint, public trust, you got to start all the way over. And that's what I love to see.
And then one of the more controversial changes is the change in public safety, changing some sworn police officer positions to civilian positions, things, just everything from crossing guard to answering non-emergency calls. What's on that, and people concerned that it's going to impact public safety? What are some of the concerns about that impacting public safety and how that would work?
Sure. I mean, if you think about it broadly, I mean, what the moment demands is for us to test institutions and look at things that really we haven't looked at in a while, and think creatively about, are there other ways to engage the community into some of the emergency responses, sort of change the trend of sort of the last decade or so. The public safety, the portion of the budget is increased to 70% of the budget, and it puts a lot of pressure on other services. People care about libraries, people care about parks. And the more of the budget that's eaten up by, that's used for police and fire, the more pressure it puts on there. So we have to really be smart about how we begin to make strategic investments into health, maybe contribute to this movement of divesting and reinvesting into health and community services by looking at what services, how could we have a more efficient police department in terms of prioritizing their calls by building capacity with non-violent calls. That means call center.
That you're concerned that it's going to impact public safety. I mean, you saw what the union circulated.
It's a pilot. I think what we're doing is we're exploring defining safety more broadly than just suppression. The concept here is that by the time you call a police officer, it's sometimes too late. The emergency's already happened. How can we start to divert people towards services to build more community capacity to respond to emergencies? Or if let's say there's a mental health crisis, who is the best spokesperson to address that response? Is it a police officer who could be, focused on a different issue? Or could it be a public health nurse? Could it be a firefighter? These are the conversations that we have to explore. That's what meets this moment. And you see that that's happening both in this budget and the reconciliation plan. Both a study on some of the accountability issues, but also investments into things that needs to be sworn, but can be civilian. It could be, we're looking at an additional phone number, a non-emergency phone number that people can call when it's not a violent emergency, where the response could be not necessarily the first response is a police officer. And by exploring these things, what does that mean in terms of police officers being able to respond to the things the community wants? It means reprioritizing a bit and building additional capacity. So we got to start it off now. We got to pilot these things. Am I advocating to eliminate the police department? Absolutely not. I know that the conversation has been divisive in that way. No, but is this the moment to think about more broadly building up our health department, building our community-based partners, building up our public health capacity within the community? Absolutely. That's what this moment calls. And I think the city's going to continue to have that really smart, meaningful conversation on how to get there.
And a question from one of our readers on this. We take reader questions. Some are saying the police department should be cut by 10 to 20%. The city has recommended cutting 3 to 5%, roughly.
The city's recommending to cut 5.2%. Is
it 5.2?
And it's 5.2. And so there's a chart, and to put that in comparison, there was a chart that shows last year's budget to this year's budget, and it shows 1.5%. So let's clear up how that works. Last year's budget was the cost of the department last year. Every year, based on just regular growth from pensions, workforce costs, all those things, the cost goes up. So the cost from last year, you add the growth, which is our deficit, the amount you have to make up by revenues, and that grows. And then from there, the budget that's being proposed is 5% less than what that cost is. That's a cut. That's a 5.2% cut that police department is having. It's not pretty to talk about. When you talk about this, you talk about livelihoods and all those things. But what it did was a few things. It stopped the trend of heading sort of more percent of the budget, 68, 70% of the budget heading that direction. It stopped that trend. It allows the room within the budget to make strategic investments into building health capacity, additional alternative forms of response. And as we invest in those things, our dependency is investing upstream to sort of lower the dependency on policing downstream and suppression downstream. And so those are some of the investments that you see there. My general thoughts are, I agree that we need to head the other direction for the sake of the fiscal health of the city and to make sure that we are able to have libraries and parks and all these things. So my philosophy is that you're going to need a more well-balanced city, and you have to make some of these investments. Do I support going into a deep cut of 50%? I don't support a 50% cut, which is what I've heard. I don't support that. What I support is I think we should de-escalate where we're going. We should de-escalate the trend of going up, and it needs to be going down. We need to see a more balanced budget that makes better investments into youth, public health, communities like North Central West Long Beach, and then the dependency on downstream policing will go down. I also think we need to take this moment to really, contribute to the national conversation on alternative forms of policing. Long Beach is 500,000 residents. I like to say that we're big enough when we do something, people pay attention. We're also small enough to test things out and be innovative in case things work or don't work. We can take those, we can do those strategies. And so yeah, I think what we need to be doing is committing from a philosophy standpoint, committing to a new philosophy around policing, really embrace community policing, violence prevention, upstream investment, public health. That's where we need to be going. And that means it's going to be tough conversations with our police department and all of our departments.
What are some of the concerns if you've had with Long Beach Police Department in recent years? Have you had any concerns with the way they police?
I think generally there's a demand to just have more, it's not like you can point to the good old days of policing and say, man, policing was great back in 1962. Like policing wasn't great in 1962 or 1945 or whatever it is. So my philosophy is you just have to continue pushing the envelope to create modern, accountable policing. And that means you have to address where it came from. Policing, the concept of policing, within communities, especially communities, African-American, Black communities, it really goes back to the whole concept of slavery and the overseer. And there's never going to be real trust when that concept is still there. And so how do you build community trust? I think we have to look at hiring, training. I think we have to look at the academies, the culture within the departments, build real trust and congruency with the public. Those are the things we have to do. Those don't get done overnight, but I think what the city council is doing is making commitment to those things, making a commitment to putting forward a department that people can trust. I'm committed to that work. It's not going to be easy. It's going to ruffle some feathers, but change is never easy. The question is this the right thing to do in this moment? Is this the right direction for a city? I personally believe that this is not a moment to sweep things under the rug. I believe this is a moment to address issues head on, talk with our communities, and put a framework to move forward. And that's what the city council is doing. Is it perfect? No. The whole point is we're going to continue to get better. We've learned a lot through this first step. Our Latino community needs to take a deeper dive, and racial equity means we need to address unique barriers. Our Latino community, we need to address those barriers. Our Khmer community needs to continue to address those barriers. So I want to see more work happen moving forward. But I think where we are, by building this team and building this capacity, we're in a position to do that.
And you're president of Skag's, Southern California Association of Governments, right? Skag.
Yeah.
And Skag's is even now getting involved in some of these issues that are similar to the framework of reconciliation, like a lot of organizations. Can you talk a little bit about their role as well?
Yeah, I'd love to. So Skag represents 191 Southern California cities in 6 counties, 19 million people. It's about the size of the region around Beijing. It's the largest metropolitan planning organization in America. Long Beach has been a member for a long time. The organization is responsible for things like the regional transportation plan, the sustainable community strategy, the regional housing needs assessment. These are really important documents that help guide the direction of the region. All of those are happening right now. Our Connect SoCal plan, RENA, all those things are happening now in the middle of a pandemic and economic crisis. So now's a unique opportunity for Skag to really be a leader, and as we put plans forward, do so in a way that it creates real opportunities and closes economic segregation, health disparities across the region. So we at Skag, we took a historic step. Skag has never done this before. We declared racism a public health crisis. We established a program called the Call for Collaborators, dedicating $2 million to community organizations to partner with local planning agencies to build housing production plans with a racial equity lens. And as president, I'm announcing a President's Council of Racial Equity for Southern California, which will have university presidents and a whole host of individuals that are going to help inform planning for Southern California in the years to come. So it's really, I wasn't originally going to be president this year. The first vice president took a position in the president's administration, which moved me to first vice president. I ran for president now, and I didn't know when we did this, we'd be in the middle of a pandemic. But I think the message is still the same. We need to all be prepared to focus on the economic recovery and make sure that it's inclusive for people. That is our top priority, that is inclusive and healthy for people. That's what we need to be focused on in the region and right here in Long Beach.
I believe we're pressed for time, or can I interject with another question in here?
Yeah, keep going. I'm good on time.
All right. Just wanted to ask this. Rex, you and I spoke about the Black Health Equity Initiative being passed to essentially provide a more effective way to ensure that state and federal funds make it to underserved communities, such as Black Latino businesses can actually benefit from these funds.
Right.
Can you kind of talk about a bit about that, how that works, and long term, how will it continue to take in those monies and continue to distribute it?
Sure. So unfortunately, in this emergency response continuum that we're in, we receive a lot of support from other sources, federal, state. And our challenge is to put a front door on it and to deploy it in a way that's strategic. Well, by having a health department, we've been able to publish race data similar than others have, and really understand, very early on, the impacts of the COVID-19 pandemic. We were able to target the senior centers, target the zip codes, and understand where these things are. What it told us is that the pandemic is highlighting health disparities and impacting the Black community, the Latino community, poor people, seniors very differently. And so we need to tailor our strategies to address that. So in the city, initially, we didn't receive CARES Act funding because we're just shy of 5,000 people. For example, Sacramento, which is slightly larger than us, they received $80 million in direct support. We're 15,000 people less than Sacramento, received zero. And so we advocated, Skag, the mayor, the region, we advocated to support cities between 300,000 and 500,000 residents. The state legislature put that forward. Long Beach received $40.5 million. From that, about 20 million went to plug the hole. Like we've been spending, I believe $1 to $2 million a month just on testing. We were able to do some reimbursement there, but also it freed up about $20 million to make strategic investments. We aligned it with Black Health Equity. We aligned it with the need for food security, PPE, small businesses, coronavirus relief fund for all nonprofits, and more specifically with the Black Health Equity Initiative. We have a Black Health Center and a number of different departments who are coming together to really think about how we can partner with community groups to really build capacity to address these issues, some of these issues in the Black community. And there's also, we place a racial equity lens on all of the funds. So in every fund, we should be able to explain how the Coronavirus Relief Fund or the Basic Needs Fund helps address issues in the Latino community and the Khmer community. That's the idea of a health equity lens. When we look at it, we should be able to see very clearly the intent and how we plan to have measurable outcomes. And that's my expectation for these funds. I was clear on that at City Council, and that's what I'm going to be watching for as these resources are deployed.
Great. Well, we are running out of time, so we thank you for joining us. And one last little question for you. There's talks that our mayor could be moving on to some type of higher office, especially if Joe Biden gets elected this fall. And your name has come up in the ring as some potential people that could potentially take his place. Would you consider running?
I thought you were going to ask me about the oil measure. That's what I was hoping to talk about. Listen.
We can talk about the oil measure if you want.
Right. Look, I have tremendous respect for Mayor Garcia, and he's been a tremendous leader during this pandemic. He's brought down resources. He's dealt with his own personal family challenges, and I really empathize with what he's dealing with. He's an incredible leader, and I want to see him do whatever is best for him. I support our mayor, and I'm committed to the 9th district. I ran for a 4-year term, and I'm committed to that. So there's still a lot of things that need to happen. And so I think it's right now there's conversations about naming high schools and all, and what happens next year. I'm less concerned about we haven't been able to see month to month what's happened. So I'm really more concerned about making sure the city is in good shape, that we're being supportive of our staff and our mayor, and that North Long Beach continue, the progress we've made isn't set back due to this pandemic. That's my focus. I'm less concerned about politics and what may happen years from now and in the future.
And speaking of naming high schools, there's been a petition or talk circling around to rename Jordan High School. Would you support that?
I think we should rename Jordan High School. In the framework, there's a recommendation to look at index, like our cultural index, and to begin the process of reviewing some of the names of our facilities. I learned from the process of naming the Obama Library and the process of naming the Village Art and be centered on the community. The youth really spoke up in the Obama Library process. I want to hear what the youth of Jordan High School have to say. I want to hear from the North Long Beach community. I think it's great that elected officials are saying what they need to happen, but I want to hear from the community on what they think is happening.
Community, do you have any names, like anybody you think?
I don't. I know there's a recommendation for Dr. Williams, and I know Dr. Williams, and tremendous respect for Dr. Williams, but I really want to, like a few things, like the school district should come in with the city on this broader naming process and be a partner before we start picking off what to name here or there. We should also go to those communities and ask for their opinions. I do that. We did participatory budgeting. We built neighborhood associations. We went through the process of naming the Obama Library by engaging with the community, 5 different sessions, hundreds of people engaged. And that's what's expected of government nowadays. You just have to do that. And so what I'd like to see is a school district, maybe the college district, they come together with the city in this process of reviewing all of this. And so the whole community is sort of unified, because right now the city's got a big crisis in front of them. The school district's figuring out what they're going to do in the fall. I think those should be the priorities right now. And then we can get to naming and some of those other things once we determine what the process looks like. So that's my opinion. Am I committed to the Jordan name? No. I think now's the time to review some of those histories, but at the same time, I don't want to alienate the North Long Beach community from the conversation. It's an anchor. We're investing our tax dollars into building this. Recognizing students every single year with banners. It's a part of the same complex of Houghton Park. It's the heart of our community. And so it really should be centered on the community. So those are my thoughts.
I think Felton Williams High School sounds pretty great.
I like Felton. I just don't want to get ahead of the community. So you won't hear me endorsing a name or anything like that at this point. And to be fair, I haven't had a conversation with Felton about this either. So yeah. We're overdue to talk.
He's a pretty modest person too, I guess. I do have a quick question on the oil tax issue. Is there's some concern or question? I'm clear on this. I need to talk to the city attorney, but some realities around Long Beach actually being able to tax.
Yeah. So we are to define it. Long Beach has a long history with oil and both producing oil and taxing oil. I believe we started taxing oil in the 60s. We increased the tax for a purpose in 1990. We increased it again. The city auditor led the effort to increase it in 2009. These are not gas taxes. I know there's efforts people to call this a gas. It's not a gas tax. You don't see it at the pump. This is a tax on local production that happens in our communities to make sure that those resources are coming back to our communities. Now, you do see some evidence of resources from oil coming back to our communities, like, you know, investments into the aquarium and Belmont Pool and all of that. The issues with, you know, sort of the tightlands and the rules around tightlands are that those funds have to be spent in the coastline. It creates this drama, you know, this tale of two cities. $100 million over here where we can't build community centers or pools and in other areas. And we've talked about this. And so one of the few things that we can do is go to the voters and get permission to tax it. And that's what we're doing. We know that there's disparities. We know that we need to get prepared and invest more into climate. We're not doing all we can around youth, early childhood education, investing in youth, youth development. And we know that we're in the middle of a pandemic and we haven't funded the health department to the degree that we should. We need to be invested in community-based health outcomes. These resources can do that. There's the conflict with state lands. I'll say that they wrote a letter at each time that this has happened, you know, the 90s, 2009, and now. And per our city attorney, who's the official voice of our legal position, that it's that the issues haven't changed over time and we have a legal standing to continue collecting taxes the way we have in the past. So I challenge people to say, when people point at this measure and say, hey, for some reason it's not valid for whatever reason, question why haven't they said that any other time? When it went to fire, police, and all these other issues, why were these questions such a big issue then? I think right now, this is for us to invest in our youth and invest in our health and our climate, and that's what's important. And we've kept the door open to continue discussions with the State Lands Commission. They thanked us for opening up those conversations and allowing City Council some flexibility to do that should the measure pass. And I really feel hopeful that we'll actually find some issues, some ways to address some of the longstanding issues that address that, you know, related to oil in our community. Like, what happens at the end of life of the oil items? Are they going back to the ocean, or they're going to be adaptively reused? What's better for our environment? All of these questions really need to be addressed, and the door has now been opened for that. And so I'm strongly supporting the measure. It doesn't tax residents and make strategic investments into our youth. It just makes sense, and a health in a pandemic, and our climate, which creates, you know, jobs. So I think it makes sense, and it's a small adjustment. Just brings us in line with what Signal Hill is. Signal Hill last year was at 67 cents, and we were at 47 cents. This just brings us in alignment with Signal Hill.
Yeah, I was surprised to see that we're so much lower than other cities, and you know.
Right. Yeah. Absolutely.
Oh, great. Well,
you asked a lot, Kelly. I think we covered it all.
3 minutes. Right. Well, thank you so much for joining us, Rex. And this will air on our YouTube channel for people, and you can we can try to get some people's questions answered later on as well if you guys have more.
Sounds good. And if you want to keep up with me, it's at Rex Richardson on Twitter, at Rex Richardson LB on Facebook.
Well, great. Thanks, Rex.
A lot. Take care.